it's Finn. I am 1 whole year post-op, which is absolutely incredible. It's gone so really quick, so happy packiversary to me. Incredible. I've been really bad at doing my updates. I kind of did really well up until 6-7 months and then just kind of forgot. But to be honest, most of the changes happened in those first 7 months. Since 7 months to now, it's been just a really gradual lightening of the scar, really, more than anything. So yeah, sorry about the late update. So this is my chest at 1 year post-op, and I am incredibly pleased with how it's turned out. I will do a little slideshow at the end so you can see the progression of it. Superman pose. What can I tell you? I love Andrew Yelland. That much is definitely true. So at a year post-op, these scars will continue to whiten. I'll come a little bit closer so you can kind of see where they're at. They have lightened so much, and they continue to lighten on a daily basis. I'm really pleased that they just haven't stretched, and the one bonus now as well, I hope this does show up on camera, certain people don't believe me, I have got the starts of a hairy chest. It's, you know, like on the edges of rugs, the fancy rugs, they have like that kind of like fancy frilly edge thing. It's kind of like that on my scars, which is quite amusing, but at least that's kind of helping to hide the scar as well, and I get a nice hairy chest, which is awesome. So yeah, everything's healed obviously nicely. I am still using the massage and the Killer coat, although not anywhere near as regularly as I was. You know, I'm just going to get to the end of the tube now. I think at this point probably the silicone isn't going to do a huge amount other than just keep some moisture on there, so I'm probably doing it once a day and not every day of that. Sorry, I had a cold. In terms of everything else, sensation wise, I have a load of sensation. I really didn't think I would have much. This area here is still kind of the numbest feeling, but in all I have quite a lot of sensation. I actually have quite a lot of sensation in my nipples as well, and they react to the cold, as you can see. They're still quite tender. I guess it's just continuing nerve endings coming in that are quite sore. They're not sore, they can be a bit uncomfortable. There is only one thing that I have slight concerns with that I'm still working out in my head whether I should be concerned or not, and that is for my nipples. I am concerned that my nipple bit in the centre is quite big. I've been prodding them as well now, so it's not helping them, because they're sticking out more than ever. So if I just come closer, I do worry that this nipply bit is bigger than I'd like. You know, I used to see pictures of men's nipples and they'd have like a tiny weeny nipple, and I guess that's probably what I would have wanted. So I've had periods of being a little bit paranoid and needing some reassurance from Nat that my nipples were okay, and I've googled lots of pictures of men's nipples just to check. And there are all different sorts of nipples out there, so I've kind of thought, do I go and see Mr Yelland and ask for his advice and maybe a revision, or don't I? And I still don't know, the jury's still out on that one, I'm not sure. I absolutely love my chest, and I don't think these are that bad. I think it's just, I think getting used to having nipples is also something quite strange, because, you know, nipples meant breasts before, and now they're male nipples, and it's still trying to get used to that. Stop feeling yourself. So I don't really know yet. I mean, I wanted to wait a whole year to give everything time to settle before I made any decision anyway. I don't know, maybe you can give me feedback on my nipples. That would always be useful. It's always good to have feedback on nipples. But the thing is, you know, I love my chest. So if I did go and have anything done, would it then be worse? And there's the question of, you know, at what point do you stop if you're going to have, like, revisions? I mean, if it was something glaringly obvious, then yeah. But it's just such a little thing, really. I don't want to be part of, you know, just revising everything to be absolutely perfect. You know, we are all different. And if I'd have been born male, you know, I would have had a chest that I would have just kind of got used to over time and not changed. So I don't know. So yeah, please comment on my nipples. Let me know what you think of my nipples. What else can I tell you? That if you go with Mr Yelland, you just will not regret it. Mainly. There isn't really anything to say. I'm just here to show off my chest, feel myself a little bit, and ask for your feedback on my nipples. That's it. That's it. So we'll have a before and after. And then at the end I will put a montage of chest-related photos out there. Do you know, let's just be serious for a minute, right? It is incredible to have this chest. It's a year now, but there isn't a day that goes by that I don't wake up, lift up the covers and go, or just love the fact that I can come home and just chuck my top off, or that I'm outside and in the sun and I just take my top off, and it's so incredible. And this now just feels like it's always been my chest and it's how it should be, and it's just absolutely incredible. And yeah, I don't know, that awful dysphoria that I had of looking at myself is gone. You know, I have some lower issues going on and surgery coming up, but this makes so much of a difference. You know, what's in my pants can be hidden away from the world and nobody knows any different, but this, you know, having a shirt on and having the proper shape under a shirt and not having to sit like this, and you know, all the worries that come with having the wrong chest for a man, if you know, and just incredible, absolutely incredible. So yeah, if you are pre-surgery, don't worry. It's going to come a time where you're suddenly a year down the line after having top surgery and go, wow, how did that happen? It just felt like forever to wait, but now I'm that side of it, a year gone, and you know, it's incredible. So you will get there, and if you've had top surgery, get your top out and love it. Yeah, I'm going to shut up because basically I'm waffling how wonderful my chest is. If you would like any questions seriously answered about top surgery, please do drop me a message and I will answer that seriously. But yes, I'll leave that there. Thanks for watching everybody, and take care. Bye bye.